Whooping cough. Overview. Whooping cough, also known as pertussis, is a highly contagious bacterial infection of the respiratory tract caused by Bordetella pertussis. It is characterized by severe coughing fits that can make breathing difficult and may produce a whooping sound when inhaling after a coughing spell. Key facts about whooping cough.
Cause.
The bacteria Bordetella pertussis attach to the lining of the airways, releasing toxins that irritate the respiratory tract and cause inflammation. Transmission. Airborne droplets. Spread occurs when an infected person coughs, sneezes, or talks. It is highly contagious, particularly in the early stages. People of all ages can contract whooping cough, but it is most dangerous for infants and young children. Symptoms. Symptoms typically develop in 3 stages over several weeks. 1. Catarrhal stage, 1 to 2 weeks. Mild symptoms resembling a cold. Runny nose. Mild cough. Low-grade fever. Fatigue. This stage is highly contagious. 2. Paroxysmal stage, 1 to 6 weeks or longer. Severe, uncontrollable coughing fits, paroxysms. Coughing episodes followed by a whooping sound when inhaling. Vomiting or exhaustion after coughing fits. Infants may experience pauses in breathing, apnea, instead of the classic whooping sound. 3. Convalescent stage, weeks to months. Gradual recovery as coughing fits decrease in frequency and severity. Persistent cough may last for weeks, known as the 100-day cough. Complications. Whooping cough can lead to serious complications, especially in infants and young children. These include pneumonia, the most common complication. Seizures, due to reduced oxygen levels. Brain damage, rare but possible in severe cases. Weight loss, from difficulty eating due to coughing. Rib fractures, from intense coughing in older children and adults. Infants under 6 months are at the highest risk of severe complications, hospitalization, or death. Diagnosis. Based on symptoms, especially the characteristic cough. Laboratory tests. Nasopharyngeal swab or aspirate detects Bordetella pertussis bacteria. Polymerase chain reaction, PCR, identifies bacterial DNA. Blood tests check for antibodies or signs of infection.
Treatment.
1. Antibiotics. Macrolides, e.g., azithromycin, erythromycin, are the first-line treatment. Antibiotics are most effective in the early stages and can reduce contagiousness. 2. Supportive care. Adequate hydration.
Rest.
Hospitalization for severe cases, particularly infants, to manage complications like oxygen therapy or suctioning mucus. Prevention. 1. Vaccination. DTaP vaccine protects children under 7 against diphtheria, tetanus, and pertussis. Tdap booster, recommended for older children, adults, and pregnant women to protect newborns. 2. Herd immunity. Vaccinating family members and caregivers of infants helps prevent spread. 3. Infection control. Avoid close contact with infected individuals. Practice good hygiene, such as covering coughs and frequent hand washing. Prognosis. With proper treatment, most people recover fully. However, infants and individuals with weakened immune systems are at higher risk for severe complications and prolonged illness. Global impact. Despite vaccination programs, pertussis remains a public health concern. Outbreaks occur periodically, often in communities with low vaccination rates. Early detection and immunization are key to controlling its spread.